live on YouTube.
We'll discuss it later. Maybe we'll involve both of you.
Yeah, sure.
It's a good
So
idea.
Sanaji,
Yeah,
it is
definitely.
live on YouTube, so you may start.
Yeah, just a minute, sir. Just
Okay.
yeah, we are under process.
Okay. But it shows live on YouTube. It already shows.
Yeah. Yes, sir. Now. Yeah. Sir, now we are live.
Okay.
Yeah.
So Sanaji, we can start.
Yes, sir. Ria?
Okay. Okay. A very good afternoon. Someone has rightly said, every time you light up a cigarette or e-cigarette or put tobacco in your mouth, you're saying that your life isn't worth living. With all the warm greetings, I extend my heartiest welcome to each and everyone invited in this meeting. Today, we all have joined for a virtual awareness workshop. The topic of the workshop is quitting tobacco or nicotine, smoking curable tobacco weapons to save yourself from addiction, diseases, and death. This event is organized by Chitkara Global Health Institute, Chitkara University, Punjab, in technical collaboration with Strategic Institute for Public Health, Education and Research, SIPR, E-Resource Center for Tobacco Control, ERCTC, and the Department of Community Medicine and School of Public Health, PGI Chandigarh. We all have in our midst the first speaker of the day, Dr. Preeti John, who is the director of Chitkara Global Health Institute, Chitkara University, Punjab. She is an alumni of Tata Institute of Health Sciences, Mumbai, and IIT Madras, from which she has obtained a PhD degree. She has 25 years of rich experience with focus on healthcare organization, and her core focus have always been healthcare human resource and capacity building initiatives. She also has been honored with various awards like the Change Agent of the Year in 2019 by the Institute of Healthcare Improvement, scholarship in 2018 as Women Leader in Global Health, and she is also considered one of the 50 global mentors for women in global health. Today, she will be delivering the welcoming address and familiarizing us with the objectives of the workshop. I would like to hand over to Preeti, ma'am.
Thank you very much, Ria. And on behalf of everyone at Chitkara, I warmly welcome all of you, the audience, the young audience, as well as the panelists, to this very important session. The basic aim of this particular workshop or this sensitization session, the aim of this sensitization workshop is to motivate all those, and particularly the youth, to quit tobacco, vaping. So we have in this session quite a diverse set of experts from different areas to deliver different messages on this extremely important topic. As part of the Chitkara Global Health Institute, one of our key aims is to work with youth to understand what are different problems that they face, which could hinder their ability to fully enjoy a good quality of life. And among that, I think it is only very appropriate that we have the privilege to collaborate with two very important organizations, both the Strategic Institute for Public Health Education and Research, CIPHER, as well as the E-Resource Center for Tobacco Control under the Department of Community Medicine and School of Public Health, PGI-MER, Chandigarh.
Oh.
The audience which is listening today, they are primarily in the age group of probably under 25. And the idea is that as you listen, you also think about people who are tobacco users and encourage them to understand the urgent significance of it. And on this note, I once again welcome everybody. Wish that you listen carefully, write your questions in the chat, and think about the advice that the expert panelists will give you and take action after this session. Thank you.
Thank you, madam, for briefing us regarding today's session. Now I'd like to introduce our next speaker, Mr. Cyril Alexander, who is an executive director of Mary Ann's Charity Trust. He is also an alumni of Johns Hopkins School of Public Health, Baltimore, and he is a well-known tobacco control activist, especially known for his work on tobacco industry interference. Today, he will be guiding us about involving children and youth in tobacco control and about his tobacco monitor app. So over to you, sir.
Thank you. Thank you very much. See, yeah, Children Against Tobacco. It's a student-based child rights organization working in the field of tobacco control. And then the main focus for this is it's a student movement to work towards a tobacco-free environment. So we want to create a tobacco-free environment. For that, we have initiated this Children Against Tobacco, Youth Against Tobacco. Through a student body, it aims to developing a responsible citizens for the future generation. So really we have to concentrate our future generation. For that, we have to work with the children. We used to work with community and then the other groups also. But the success rate is very low, and then we are not able to achieve what we have decided. But working with children, it's an interesting thing, and then the children are able to understand the realities, and then they are also taking care of the tobacco control activities in the community. So working with children, it's always a best thing. And then in our children's movement group, the CAT, the age group will be from 8 to 18 years.
Mr. Cyril, there's problem with the audio. Can you make it better, the audio?
Yeah. Can you hear me now? Maybe I can speak in louder. Yeah. Can you hear me now?
Little better now. Better.
Yeah. So we start working with children in the age group from 8 to 18 years. Why we are going up to 18 years as per the CRC, Child Rights Convention. So Child Rights Convention is up to 18 years. So we cover this 8 to 18 years children. So we will be giving first we will be giving a introductory workshops to the children. It will be a 1 hour session. After that, we will be moving to the leadership program and other programs. The methodology we adopted, there will be an input session, and then there will be a storytelling, because really we have to use this cultural way of educating our children. So we have a storytelling session, and then we are also published stories in tobacco control. So we will be using the tobacco control stories with the children, and they will be coming with a role plays and role models. And then we will be screening a Third World War. It's a documentary film, and then we will be having a cancer survivor speech. So when cancer survivor is giving the information, that's the first-hand information. Definitely the children will take it up, and then they will send it to the community. Next, please. So that's why we started this program. The CAT leadership, it's selected members. See, if you are going to the particular school, and then the session, most of the children will be attending, and then the selected children will come again, and then we will be giving a leadership 1-day program. So during this leadership program, we'll be giving all input session, and then the interactive session, and then they'll be creating some stories and all these kind of things, and then they'll be educated in tobacco control. After this leadership training program, the children will be responsible for the entire school. So they will be taking care of the entire school premises in tobacco control for like 100 yards. If suppose the sales is happening in 100 yards, and then they are the person who send the information to the school HM through the school leader, and then the HM, and then it will go to the health department. So the children will be involved in this kind of activities. So the leadership is a very important thing. And then the next, please, the different role present by CAT unit. First, the CAT unit, they will be form a small unit, And then they will, everybody will be the member, around 20 to 30 people per school. They will be the member of the CAT unit. It's like a scout or NSS or NCC. And then from this group, and then they will be elect representatives. There will be a president, vice president, secretary, joint secretary, and treasurer. So there will be an executive body. And then the teacher, the school teacher, one or two teachers will be responsible for the CAT unit. So they will call as a CAT officers. So the CAT officers will work with the children, and then the CAT unit will be functioning in the schools. So the 5 pillars of the CAT program, the CAT works mainly through 5 pillars. The first, the school, we have to get the permission from the school, and then the school commitment, it's also very important. And then the teachers, the trained teachers are very important. And then the students, and so parents and the MACT or any other organizations on initiating this initiative in the schools. So these are the things. The next, please. The activities of CAT unit. First, we will create a tobacco-free zone. So first, our premises has to be tobacco-free zone. So there won't be a sponsorship program or anything else in the school premises, as well as the 100 yards will be handled by the children. So they will be doing a monitoring work and all these kind of things. And then the educating the peer group. Because of the peer group, the children are going to use the tobacco products. So really we have to address this peer group pressure. So for that, the CAT unit members will be addressing these peer group issues. And then through these children, and then we will be sensitizing the parents. If straight away, if you go to parents, and then it's very difficult for us to handle the parents or convince the parents. But the children are able to do it. They will do their own family members, and then they will work with their own. And then it's very easy for them to convince the adults. So we are doing this kind of community-based interventions through children, and then the CAT day out. So every month the children will come together, and then they will visit their premises. They will go for a trip nearby the schools and other places where is there any tobacco products available or this kind of things, and then they will send a complaint through the our official channel. And then the tobacco monitor. Tobacco monitor is an Android and iOS based web-based application where the children can simply they can just take a picture, and then they can send photos to the tobacco monitor, and then the things will be taken care. So like this, the children will be involved in all these kind of activities. Next, please. Working with children, it's very important in tobacco control. Even we are working with community, even we are working with teachers or doctors or any other profession. But working with children, it's very important because they are the future generation, and then they are the today's generation, and then they are the one who going to change the world. Because we are not going to work for years in tobacco control. We have to stop these tobacco control activities through our children and our youth. Thank you very much. We'll work together.
Thank you so much, sir, for joining Chitkara Global Health Institute, Chitkara University, and motivating the involvement of youngsters in tobacco control. We are privileged. Up next, we have Dr. Rana J. Singh, Deputy Regional Director of Tobacco and NCD Control at International Union Against Tobacco Control and Lung Disease. He is a medical doctor with MD in pulmonary medicine and has 30 plus years of rich experience in clinical and public health at national and international level. Today, he will be addressing the background of the issue. So, sir, can you kindly give the background of this important issue?
Hello, hi, yes, thank you very much, Ria. So good afternoon to all of you. Respected Dr. Preeti John, Director of CGHI Chitkara University, Dr. Rakesh Gupta, President Cypher, Professor Goel, Dr. Rakesh Gupta from Rajasthan Cancer Foundation, Dr. Vikrant Mohanty, Dr. Monica Singh, faculty, staff, and all the students of Chitkara University. First of all, congratulations for organizing this very important webinar workshop on quitting tobacco and related products, that is nicotine and many other similar products. You see, today is a different platform. Almost every other day, we speak in various workshops, meetings, consultations. Today is a different platform where we have our youth participants. But perhaps we are going to say same thing. Why this session, especially for you, for the youth of Chitkara University and many other who are participating in this. So first we need to understand the issue. Although today's session will focus on tobacco cessation, how we can quit tobacco if we are already using this product. But I think what we want, everyone who is here in this webinar. So we wish that you really understand what is the issue, and then I think it will be much easier for all of you to contribute to this important public health challenge. Many of you, I think I think mostly you will be from various branches of public health, doing various courses in CGHI. You see, if you ask me, which is the biggest public health challenge today globally, it is tobacco use. It is one challenge which is affecting almost every country and in a major way. So as far as our region is concerned, that is Southeast Asia region, and again, now our country, in India, we have almost 29% people who use tobacco above 15 years of age. Above 15 years of age. And you know what is the number? In absolute number, we have 267 million tobacco users. That is 27 crore tobacco users we have in our country. And what is other important thing? Tobacco is such a product in our society which kills 50% of its users, especially smokers, if it is used as intended by the manufacturer. It will kill 50% of its users. Do we have any product in our society, whether it is eatable, चाहे वो खाने वाला हो, पीने वाला हो, पहनने वाला हो, क्या कोई ऐसा प्रोडक्ट है जो अपने ही यूजर को 50% of users को वो kill करता है? No. It is only tobacco which kills 50% of its users. So this is something which you need to understand. Then why people often ask, definitely a question comes to your mind, then why this product is there? If it is really a big public health challenge. Because of tobacco, India is already world capital of hypertension, cardiovascular diseases, cancers, almost 90%, 80 to 90% oral cancers caused by tobacco. Then chronic respiratory diseases and almost every part of our body which is affected by tobacco. If you don't know what is the harmful effect of tobacco, just start from head and go to toe. Almost every organ of our body is affected by smoking. Because of tobacco, India is already one section of hypertension. So this is the dynamics of the current dynamics of tobacco. In addition to that, health burden, it has a lot of social and economic burden for the country. If for every 100 rupee which we get as revenue from tobacco, almost more than 800 rupees, roughly 800 rupees are spent on tobacco-related diseases for treatment of tobacco-related diseases. So it's a big burden. Please go through all the literature which is available freely, but definitely it's important issues for you to understand. So now how it happens? What is tobacco control? When we are talking in this session, we need to understand what is tobacco control. What do we do in tobacco control? In tobacco control, our effort is, this is a question which I often ask when we are sitting face to face in a meeting or a workshop. What do you understand by tobacco control? In tobacco control, what do? We try to stop people from starting to use tobacco every day. जो लोग tobacco शुरू करते हैं, youth, children जो शुरू करते हैं, we need to stop them. We need to stop new initiation every day which are happening among youth and children. And second part is to help people to quit tobacco who are already using. And in India, you are aware. Now, what is the number? 27 crore tobacco users in India we have. So, which is easy part? Easy part is to ensure that people don't start tobacco. Second part is really difficult, and our experts, Dr. Kesh Gupta ji, Dr. Vikrant, Dr. Monica will really explain you even that how we can do, or we can help people to quit tobacco. So we need to focus on first part. And now you as a Chitkara University, first of all, please see that our environment is definitely tobacco free. As per TOFI guidelines, it is an education institution. So we need to see that Chitkara University is declared tobacco free. You see, we often say, yes, no one is using tobacco, but we want it notified there that welcome to Chitkara University, tobacco-free Chitkara University. Every campus, every hostel, every canteen, every place, all the teachers, all faculty should be tobacco-free. So secondly, I think this is something. Secondly, if you have a healthcare center in your hospital, you have doctors, healthcare workers, counselors. So it will be good if you get them sensitized, train them in tobacco control. It's an important initiative for them also. The second part is quitting. So quitting, I often say that if you are a user, what is the best thing you can do for yourself, for your family, for your society, and for your country is to quit tobacco. It is the best thing which you can do in this scenario. Now, later too, I think our experts will again speak on that. As per GATS Global Adult Tobacco Survey, which is a prevalence study, a survey for our country, almost 38% people try to quit tobacco in any year or in past 12 months. So you know, every year 90 to 100 million, 9 to 10 crore people tried to quit. उन्होंने क्विट करने का कोशिश किया, अटेम्प्ट किया, but क्या वो successful हुए? Whether they were successful. So this is something which we need to see that how they can be supported for quitting tobacco use. But today, because it is a meeting focused on youth, I would specifically talk that in this survey also tells Dr. Rakesh ji and all other colleagues that if we see who are the people who are advised by healthcare provider to quit tobacco, the age group between 15 to 24 were least asked by our healthcare providers to quit tobacco. जिनको सबसे जरूरत है कि आप उनको एडवाइस किया जाए if people in the age group of 15 to 24 are using tobacco, we need to advise them more vigorously to quit tobacco as soon as possible, because early the age of starting tobacco use, more difficult it is to quit tobacco. So this is something which we need to see and how we can improve tobacco station services in the country, and definitely for Chitkara University. And I would always be available whenever some other responsibility is given. We need to design specific policies, specific tobacco station services for the youth users. So this is something, and I hope our experts will address this challenge, this issue of tobacco use among youth. So thank you once again, Dr. Rakesh ji, Dr. Preeti, Riya. Thank you very much. Bye bye.
Thank you, sir, for giving us a glimpse on the background of this issue. We are privileged. Like there is children against tobacco, even youth can also take initiative against tobacco. So I'd like to ask Preeti ma'am to start this initiative from Chitkara Global Health Institute as well. Now I'd like to hand over to Dr. Rakesh Gupta. He will be introducing the moderators and the expert panelists.
So good morning all. I'm Dr. Rakesh Gupta, President and Director of Public Health Cipher, and I'm a former Director of Health Services. I'll like to ask Dr. Sonu Goyal to introduce himself, and then we can start with the panel discussion. So, Dr. Sonu.
Yeah, I think we can start with the discussion. That's okay, I think.
Okay.
We'll go further.
So, Dr. Sonu Goyal is Director, RCTC Chandigarh, and is Professor in Department of Community Medicine, School of Public Health, PGI.
Okay.
So, I think we can start with Dr. Rakesh Gupta. So, Dr. Rakesh Gupta, he is President of Rajasthan Cancer Foundation, Jaipur, and he's Honorary Consultant Tobacco Cessation in SDMH, Jaipur, India. He's a technical advisor for many tobacco control programs, Population Services International India, and he also conducts some basic courses in human resource for health through USAID, John Hopkins School of Public Health, under Global Health through its e-learning center, John Hopkins, Bloomberg School of Public Health, Baltimore. So he has been honored with he has been awarded WHO Director General's World No Tobacco Day 2013 award in an individual category for Sierra region. So Dr. Rakesh Gupta, so you can present your presentation, please. So Dr. Rakesh Gupta, are you with us?
Yeah. Thank you, Dr. Rakesh. And I thank you and all other the people in the organizing team, Dr. Rana, Dr. Sonu Goyal, Dr. Preeti John, Mr. Arunji, and everybody from Chitkara University as well, and RCTC and Cypher. It's a privilege actually to talk about the issue, and we all know that the youth in the country in reference to tobacco control has not been addressed adequately and optimally as we should. And honestly, if you ask me, after 2 decades of working in tobacco control, we still don't know much about what does the youth want in tobacco control, and specifically in tobacco cessation. I think the information is lacking significantly. So this is one session, I think, which has a lot of credibility. And today is a very auspicious day of Guru Purnima also. Life is the learning process, and it is not only the learning for the students, but it is also for the gurus. So what I thought of doing is that I have prepared the presentation in such a way that the participants also respond on the chat box to each question, so that we have more information as to what do they think about it, about the questions that I ask specifically. The time is a bit short, so I would like them to be the quick fingers or the rapid responders to the questions, so that then I can give some fill-ins for each of these questions. I consider the information will be still very sketchy and superficial for the session today, and maybe more interactions will perhaps to take us to the depth of the subject information as such, and for their participation. But my format is primarily to empower the participants, primarily to understand as to what questions tobacco users ask. And I think that is very important aspect. So the first question is, why should I quit tobacco? And I would like to have your answers as to why should a tobacco user quit? Can I get some answers here on the chat box? I don't see any participation here. Is it possible? So this is like a usual classroom scenario where if you ask a question, people don't respond. So let me go quickly to the response as such. And the response is that why quitting is important is primarily it benefits quality of life, because by quitting, we revert the harmful effects. Secondly, quitting also adds years to the life. And life to the years that may be lost prematurely, because a lifetime tobacco user loses 6 to 10 years of life. Thirdly, quitting helps in saving the hard-earned money for the user himself and for the family, because you not only spend on using tobacco, but you also spend on the illnesses that those are to be managed later on. And quitting also helps in productivity, because premature loss of life also means loss of productivity for the self, the family, and for the country. The next question is, when should I quit? So when should I quit? The response is very clear here. You should quit as soon as possible. But quitting before 30 years of age spares of the harms in totality, because the tobacco user generally has used the tobacco by 7 to 8 years by that time, out of misadventure, I would say. But also it is very important that if you quit before 30 years, physically the body doesn't develop the changes which will lead to the chronic illnesses or tobacco, which are due to tobacco. And let me tell you that tobacco is a major killer. It kills about 4,000 adult Indians every day due to tobacco related illnesses like heart attack, stroke, diabetes, lung diseases, cancers of 14 types, etc. And besides so many other illnesses from head to toe. So third thing is best not to use it at all. Those who are uninitiated in tobacco use, it is important that they learn to say no to tobacco. Every time somebody offers or they see somebody and get a trigger that why I should not experiment with it, it is better not to do that. The third question is, where and to whom should I go to quit tobacco? The answer to this is that you can go for quitting tobacco to a local tobacco cessation clinic, which you may have in your region. National Tobacco Control Program of Government of India has established tobacco cessation clinics in every district now. We also have the online portals of National Tobacco Quitline Service. The toll-free number is 1-800-11-2356. And also there is a mobile telephone service. The number of this is 011 22901 Both the numbers are available on Google search also, so it's not difficult. You can give a call on NTQLS National Tobacco Quitline Service. You get registered, and then a counselor helps you proactively to quit tobacco, and they also hold follow-up sessions for helping you quit. In the other mobile telephony program, M-Cessation, you get the messages after registration in this program on your in your phone, so that it helps you through the mobile telephony to take you through the steps which will help you in quitting and staying quit. If you don't have any of these accesses, you can go to any expert or a specialist or somebody trained in tobacco cessation. If you have known about it, you can search on Google and connect with that person. And if you do not have a doctor in the vicinity, there are counselors which are also available through the other national health programs like National Program for Control of Cardiovascular Diseases, Cancers and Stroke, NPCDCS, National Mental Health Program, and I think National Oral Health Program is also going to provide such a facility. The fourth question is whether quitting is tough. The answer to this is yes, it's a chronic relapsing addiction, therefore it is tough to quit, and people sometimes require more than one effort, many a times, many more efforts. But yes, if you have decided to quit, you will become successful. Why quitting is tough is also because not only it's the physical reward mechanism of getting some pleasure out of it through the hormonal secretions which occur in the brain and affect our frontal part of the brain. It is also because of the triggers which come with the behavior and the social aspects. So behavioral and social issues require an optimal management. Support of the family and environment is vital, therefore. The key to success, therefore, in quitting is to eliminate all these triggers in totality. Let me repeat, the triggers are physical, psychological, and social. We have to eliminate all these triggers for a successful quitting. The fifth question is how it is made easy. Can the quitting be made easy? Yes, it can be made easy. It requires a combination on counseling and pharmacotherapy plus regular follow-ups. Either the person who is delivering tobacco cessation does it proactively, or it can be done by the patient who can come repeatedly to the tobacco cessation clinic so that he can be advised as per the needs while he is quitting tobacco and staying quit. As I said earlier, the support of the family is very critical. A positive reinforcement, encouragement, empowerment which comes and which makes the environment of the person who is living in the family tobacco free is very important. As Dr. Rana said, that for making university tobacco free, you require the environment to be tobacco free. I consider it is very important aspect that the family helps in making the environment tobacco free. But the person also has a duty, because family cannot be everywhere, especially when you are driving a vehicle or you are working in a, or you are in the university. It's very important that both these places also become tobacco free. The next question is quitting evidence-based? Everything requires some kind of evidence. We always ask for it. Praman kahan par hai? So there is a evidence, and it's a very robust evidence we have in the literature that together counseling, pharmacotherapy, and follow-ups can increase the quit rates for total abstinence. Total abstinence means somebody will not take any tobacco anytime, no slips even. Over 6 months, then the quit rates in such a scenario is between 30 to 50% at least. So compare it with the quit rates which we have presently. At the population level, only 2% of the tobacco users quit tobacco by themselves, which is very less. But if we see in the terms of the current users, just about 16.5% smokers and about 6% of the chewers of the tobacco, they are able to quit tobacco in India. So as Dr. Rana Saab said, that there is a large, huge burden we have of tobacco users in the country, which is about 27 crore. Until we increase the quit rates, we will never be able to reduce our burden and the resultant morbidity and the mortality due to tobacco. The last question is, will quitting once ensure success? Means if you quit once, will it give you the success for the life? No, it doesn't, because it's a chronic relapsing disorder. The addiction is the main cause. People get used to continue tobacco. Even if they want, they cannot quit many times by themselves. They do require assistance, but one can quit with success for life if the reasons to relapse are remembered. There are two important reasons for relapse. One is that when we are in the excessive joyous circumstance, partying, meeting some old friend, being in the festival or in the marriages, or you are having stress, tension, grief, all these occasions are the reasons for the people to get into tobacco use again. So one has to remember that if you do not wish to relapse, whenever there is an excessive joy or grief, it is better not to use tobacco, which is toxic, which kills so many people. And I think that is very important for one to remember, that if I do not take any poison intentionally, will I take a toxic substance like tobacco to cause damage to myself and damage to my family? So to conclude, I would say tobacco use should not be there in our lives. Tobacco is a serial killer. Quitting is uncommon. Tobacco users are patients. They are not criminals. So don't make fun of them. Help them maximally and howsoever to quit, because this is their need. The takeaways from this presentation, I consider, should be: offer quitting to all the tobacco users, advise them to access for it as soon as possible. It's not easy for everyone to quit, but everybody can quit. Stay quit to get benefited for the life. Thank you very much for your kind attention. And I could say that, yes, in the scenario we have presently in the pandemic, it is very important to understand the pictures that I am showing you of the patients. One can work online with the patients, provide them the help required. And I think it is not necessary at all to be a doctor or a nurse. With the knowledge that you can have of tobacco cessation, if you are a good communicator, you have a good subject knowledge and information, and you can update yourself, you can also help people in quitting tobacco. Thank you very much for your kind attention.
Thank you, Dr. Rakesh Gupta. So you have made this quitting subject a little easy to understand. So why to quit, when to quit, where to quit, and whom to approach for quitting, and whether it is tough to quit, and how to quit, and is it evidence-based while quitting, or will quitting once ensure success? So I think people will have, the participants will have many queries, but we'll take up the queries after all the three panelists. We listen to all the three panelists, and then we can take up the queries. So thank you, Dr. Rakesh Gupta. Then now over to Dr. Sonu.
So I think our next speaker is young Dr. Vikrant Mohanty. So he is associate professor and head of the department, heading one of the very, I think, the department which is very, in the government setup, it is very difficult to see a cessation clinic and a dental department. Very few dental departments and cessation clinics are like Dr. Vikrant Mohanty. And he is a grant recipient for many organizations. One of them is UKERI, and he belongs to Department of Public Health Dentistry at Maulana Azad Institute of Dental Sciences, which is under government of NCT Delhi. And he is also a recipient of this Bloomberg Initiative Scholar. He's currently a Bloomberg Initiative Scholar under Institute of Global Tobacco Control in John Hopkins. So welcome, Dr. Vikrant. Are you here?
I'm very much here, so thank you so much.
Yeah,
am I audible to you? Am I audible to you, sir?
Yes, yes, you are very much audible. So please go ahead with your brief talk.
Yes, thank you so much, sir. At the outset, I would like to thank Chitkara University, all the organizers from Chitkara University, Dr. Rakesh Gupta, sir, and Professor Sonu Goyal for being very kind to accommodate me during this ongoing session. And Dr. Rakesh Gupta, sir, from Jaipur. It is always inspirational to see your presentations, to hear the way you simplify information and bring it to every, I would say, every person who's across on that side of the dais or across in the audience. And I really appreciated your messages throughout these years. And it is a mutual respect that I have for you, sir. Thank you so much for all the messages that you've shared. Sir, I would first like to share my slides, if that is allowed. Yes, it's allowed. Thank you so much. I hope my slides are visible. Obviously, my slides are not as simple as Dr. Rakesh Sharma's slides. They're a little bit complex, but then what I would do is I would not stick to the script. Many times what happens is we try to provide a lot of information to people, in a very short span of time. But it is very important for us to understand that at the end of it, what will be the information be used for? Okay, so the first thing is, as Dr. Rakesh Sharma very beautifully gave us those various questions, which made us understand, why exactly tobacco cessation is important, and why exactly we should quit the habit. So these questions are very pertinent, but at the same time, all of us need to believe that cessation is available. Cessation is getting more and more accessible, and cessation is surely still affordable. So these are certain things that whenever we talk about healthcare services, we have to consider it. So when we talk about cessation, different aspects of cessation are important. For example, if अगर मैं किसी रूप में तंबाकू का सेवन करता हूं, तो अगर और मुझे कहीं भी किसी भी तरह से छोड़ने का मन करता है, तो जैसे सर ने बताया कि आप कहीं भी आ सकते हैं. There are many places through which you can go. For that matter, as Professor Sonu Goyal told, that even a dentist can help you, a trained dentist can help you. So similarly, there are many healthcare providers who can help you. And बहुत जरूरी ये है कि आपको सोचना चाहिए, जब अगर लत लग चुकी है कोई चीज की, और उसको अगर आप कोशिश कर रहे हो छोड़ने के लिए, तो आपको, और वो बार बार आपको उसके तरफ खींच रहा है, तो इसका मतलब ये है कि there is a problem. And we have to understand that addiction is scientifically proven as a disease or a disorder. And we have to understand that treatment is available. सबसे पहली बात वही है कि ट्रीटमेंट, तंबाकू छोड़ने के लिए, छुड़ाने के लिए ट्रीटमेंट अवेलेबल है. पहला कदम ये होगा कि काउंसलिंग इज अ वेरी effective and very much still sought after intervention in our country. So counseling is something which is very much there. And please don't think counseling का मतलब ये है कि आपको खाली उसकी बुराइयों के बारे में या फिर कुछ चीजों के बारे में जानकारी दी जाएगी. काउंसलिंग एक बहुत ही स्ट्रक्चर्ड अप्रोच है, और ट्रेन काउंसलर्स, चाहे वो एक क्लिनिकल साइकोलॉजिस्ट हो, चाहे वो साइकेट्रिस्ट हो, चाहे वो डेंटिस्ट हो, चाहे वो हेल्थ केयर, किसी भी हेल्थ केयर प्रोवाइडर हो, मेडिकल डॉक्टर हो, हेल्थ केयर प्रोवाइडर हो, अगर वो सही तरीके से ट्रेन है, उनका अप्रोच भी एक बहुत सिस्टमैटिक रहता है. तो ये मत सोचिए, डोंट अंडरमाइन द एफर्ट्स ऑफ काउंसलिंग. बिहेवियरल इंटरवेंशन इज अ साइंटिफिक प्रूवन स्ट्रैटेजी, और जरूरी ये है कि आपको समझना चाहिए कि पहला पड़ाव वो होगा. उसको कॉम्प्लीमेंट करने के लिए जो मैं फार्माकोथेरेपी की बात करूंगा क्विकली, अब मैं उसके बारे में बात करूंगा. बहुत जरूरी ये भी है जानना कि सी टोबैको यूज व्हेन पीपल स्टार्ट, they are maybe naive, they are either experimenting, or they are influenced with certain the whole environment which is there, whether it is from the OTT platforms, or whether it is from movies, whether it is from friends, whether it is from peers or seniors, or even parents for that matter. So the environment plays a huge role when it comes to tobacco use. तो जरूरी सबसे पहले ये है कि अगर आपने शुरू कर दिया, ठीक है, गलती हुई है, लेकिन इसका मतलब ये नहीं है कि ये प्रॉब्लम सॉल्व नहीं हो सकता. Okay, so this can be managed, this can be taken care of. So when we talk about pharmacotherapy, I will not go into details of what has happened globally about tobacco and in India. I think Dr. Rana Jay Singh sir ने बहुत अच्छे से आप लोगों को प्रॉब्लम के बारे में बता दिया है. रीइंफोर्स डॉक्टर राकेश गुप्ता ने कर दिया है, और हम ये सब के बारे में नहीं बात करेंगे. सबसे जरूरी चीज जो है, जो हमें समझना चाहिए, वो डिपेंडेंस जो है वो दो तरीके से ज्यादातर होती है. मतलब एक्चुअली इट इज अ टू पार्ट प्रॉब्लम, एंड इट नीड्स टू बी एड्रेस्ड ऑन बोथ द एस्पेक्ट्स. वन इज अ बिहेवियरल प्रॉब्लम, और आई वुड से इज अ साइकोलॉजिकल प्रॉब्लम, एंड वन इज अ फिजियोलॉजिकल प्रॉब्लम. जो फिजियोलॉजिकल प्रॉब्लम, वो क्यों फिजियोलॉजिकल कहते हैं? क्योंकि जब भी आप किसी भी तरह का तंबाकू का सेवन करते हैं, तो उसमें से क्या निकलता है जो आपको कंट्रोल करता है? तो बेसिकली निकोटीन जो है वो एक गेम चेंजर हम उसको कहते हैं. हम उसको एक पोटेंट न्यूरोटॉक्सिन कहते हैं, जो बेसिकली वो एक स्टिमुलेंट है, न्यूरो स्टिमुलेंट है वो. तो वो क्या करता है कि आपके शरीर में जाता है, चाहे आप गुटखा, खैनी, पान, जर्दा किसी भी रूप में ले रहे हो, या फिर सिगरेट, हुक्का, in all forms that are taking, smoke form also. So what happens, it reaches through your system to the blood, to the brain, and it releases this these neurotransmitters of dopamine, which basically are stimulants, and they make you, they do a lot of things which are very transient. That means जो ये neurotransmitters release होते हैं, ये थोड़े हद तक काम करते हैं, फिर ये टेपर डाउन हो जाते हैं, फिर आपका शरीर जो है फिर डिमांड करता है कि मुझे टोबैको खाना लेना है किसी भी रूप में, और उसके बाद क्या होता है, ये एक साइकिल है जो चलता रहता है. So nicotine is the one which stimulates the brain and then releases this dopamine as a neurotransmitter, and the dopamine actually has many effects on our whole body. Okay, so initially it is a good feeling which people encounter, but slowly it becomes an addictive in nature, and whenever you want to withdraw from it, it pulls you back into it, and sometimes it pulls you even stronger if you are not capable enough. So it is very important that for the coming out of a particular habit, you really need help, and that help has to be understood on both aspects. When we talk about behavior component, काउंसलिंग काम करेगा. जब भी टॉक अबाउट फिजिकल कंपोनेंट और फिजियोलॉजिकल कंपोनेंट, तो दवाइयां काम करेंगी. तो लेट अस सी कौन सी दवाइयां हैं. सो आई थिंक आई हैव ऑलरेडी एक्सप्लेन्ड यू दिस. सो व्हेन डू यू गो फॉर फार्माकोथेरेपी? व्हाइल काउंसलिंग एंड साइकोसोशल ट्रीटमेंट help promote cessation, medications also address these neuropharmacological effects of nicotine. कुछ और हम as a trained counselors, we do certain assessments of patient कि आप कितने, या कोई भी आदमी कितना एडिक्टेड है टोबैको से. तो कुछ स्केल्स होती हैं जिससे हम मेजरमेंट्स करते हैं और ये पता लगाते हैं वो लो एडिक्शन लेवल पे है या मीडियम पे है या हायर हाईली एडिक्टेड है अपने सब्सटेंस से। तो पहले भी अगर किसी ने कोशिश किया हो कि मैं बार बार कोशिश कर रहा हूं और फेल हो रहा हूं, तो वो उन लोगों को भी जाना जरूरी है। उसके अलावा वो लोग जो खाली ब्रीफ इंटरवेंशन या काउंसलिंग से इस प्रॉब्लम को छोड़ नहीं सकते, उनके लिए भी फार्माकोथेरेपी अवेलेबल है। तो दो तरीके के फार्माकोलॉजिकल स्ट्रैटेजीज है। जरूरी एक चीज ये है आप लोगों को समझना कि कोई भी चीज अगर काउंटर से मिल भी जाए, मतलब एक फार्मासिस्ट से मिल भी जाए, उसको यूज करने का तरीका, उसको डोज करने का तरीका, उसको अपनी एक प्रोसेस के थ्रू उसको यूज करने का तरीका जो है वो बहुत जरूरी है। वो बहुत जरूरी है, क्योंकि इफ यू आर नॉट डूइंग दैट, then what will happen is all the efforts that you yourself as an individual are making, the doctor is making, the dentist is making, will fail if you do not follow those instructions properly. Pharmacotherapy, behavioral intervention, all these things require a systematic follow up, a systematic approach. Nicotine replacement therapy is a broad umbrella under which many other interventions are there. तो निकोटिन रिप्लेसमेंट थेरेपी के अंदर निकोटिन गम्स आते हैं, निकोटिन लॉजेंजेस आते हैं, निकोटिन पैचेस आते हैं। बाकी स्प्रे वगैरह अभी तक ज्यादातर इंडिया में आए नहीं है। ये 3 फॉर्म जो है अभी इंडिया में अवेलेबल है और ये ओटीसी मतलब ओवर द काउंटर आपको मिल जाते हैं। ठीक है। दूसरा नॉन निकोटिन रिप्लेसमेंट थेरेपी ओनली अंडर द सुपरविजन ऑफ अ ट्रेन्ड फिजिशियन विल बी गिवन। मेनली ब्यूप्रोपियोन यूज होता है, बाकी चीजों के बारे में हम बात नहीं करेंगे। Okay, so we will talk to you about, I'll not go into details of this कि कैसे देते हैं, क्यों देते हैं, ये सब आपके trained physician या dentist ये आपको देंगे। Okay, when you talk about gums, बहुत जरूरी है सोचना समझना कि निकोटिन गम्स अलग अलग फॉर्म जैसे दिए गए हैं उसमें मिलते हैं, अलग अलग फ्लेवर्स में मिलते हैं। और ये गम को जरूरी ये है कि एक प्लान तरीके से, पहले मैं क्या करूंगा, अगर आप कोई एक पेशेंट मेरे सामने आता है तो सबसे पहले आप जो है ना हम उनको असेस करते हैं, उनका एक प्रोफाइल बनाते हैं कि वे कैसे आदमी इस चीज का सेवन करता है, सुबह उठ के कब खाता है, फिर उसके बाद कब खाता है, दिन में कितनी बार इनका वो ही इज बेसिकली एक्सपोज टू ऑल दिस, एंड अल्टीमेटली वी मेक अ प्रोफाइल, and individual profile is made. On the basis of that individual profile we plan the whole treatment. So when we talk about planning the treatment, we tell him that, see, you're going to use a 2 milligram or a 4 milligram, and if you're consuming these many number of cigarettes or BDs or chewing so many tobacco pouches, then you will have to have this much amount and this much amount for the whole day. ओके तो एक मिनिमम नंबर ऑफ डोज होते हैं, एक मैक्सिमम नंबर ऑफ डोज होते हैं। उसके अलावा आपको एक समझना जरूरी है कि ये किस तरह से चबाया जाता है। I'll talk to you a little bit more of that. So this is what is the whole system. If you're taking Nicotex or any product for that matter, you need to, it is called a park and chew method. प्रॉब्लम क्या होता है, बहुत लोग इसका सेवन करने को, हाँ हमने तो गम ट्राई किया है लेकिन ये इफेक्टिव नहीं है। ये इफेक्टिव इसलिए नहीं होता कई बार क्योंकि आप सही तरीके से उसको चबाते नहीं हो, आप सही इंस्ट्रक्शंस फॉलो नहीं करते हो, शायद आप लोगों ने कोशिश की होगी लेकिन बीच में इसका साथ छोड़ दिया हो सकता है। So you have to understand that all this is a very systematically planned approach, and it can only preferably be done under supervision. And once you learn the technique, then you can be allowed to take it further. Okay, so you need to chew it first. You get a peppermint or a peppery taste, and once you get that peppery taste, you need to park the gum into between the buccal mucosa as well as the in between the teeth and the buccal mucosa. तो ये आपके गाल के और जहां पर जगह है नीचे की तरफ, वो वहां पर रहेगी थोड़ी देर तक, जब तक ये टेस्ट चला नहीं जाता। जब ये टेस्ट चला जाए तो दोबारा उसको निकालिए, फिर से चबाइए और फिर दूसरी तरफ रखिए जहां पर आपने रखा नहीं था। तो ये अपने आप में एक साइकिल होता है। तो इस तरह से 7 से 10 साइकिल करीब आधे घंटे तक आप इस गम को चबा सकते हैं और फिर इसको थूक सकते हैं। थूकने का भी आपको ध्यान रखना चाहिए, जो भी आपके अंदर से सलाइवा निकाल रहा है उसको अंदर नहीं लेना, उसको थूकना है। ठीक है ना? So it might, many times it causes hiccups, many times it causes burning. So sometimes people complain of these things. You should be careful and always report it. अगर बार बार ये तकलीफ हो रही हो तो आप अपने हेल्थ केयर जो भी फिजिशियन है, जो भी ट्रीटिंग डॉक्टर है, उनको आप जरूर इन्फॉर्म करिए। So don't smoke while you chew the gum. Use one gum at a time. मेरे को लगता है कई बार कि हाँ मैं 2-3 गम एक साथ मिला के खा लूं तो शायद मेरे ये चला जाएगा, क्रेविंग चला जाएगी। Because craving is something which is the most common withdrawal symptom once a patient tries to leave or a person tries to leave it. So you have to understand that it does not happen that way. It is a fixed dose given for a fixed time and it has to be repeated. So if you're doing that, then only we will see the effectiveness. Chew it slowly, park it properly, and then continue this process of chewing and parking till the time the whole taste is tapered off. Don't drink or eat anything in the next 15 minutes to half an hour. Avoid any stimulant, like for example coffee or soda or thumbs, any cold drink avoid करें आप लोग, ठीक है ना. तो इन चीजों का ध्यान रखिए और इसके साथ आप और भी हेल्प ले सकते हैं. Gum is very popular. It costs between 5 to 7 rupees per gum. So try to understand that these gums are medications. They are to be used as medications, not like continuous a normal chewing gum. Please remember that. If you're doing it, then it is wrong because you are actually misusing the available resources. One. Number two, you're misusing an intervention which can really help you. Ultimately, अगर आपको छोड़ने का मौका मिलेगा तो आप शायद ना छोड़ पाए बिकॉज आपने उसको सही तरीके से यूज नहीं किया. And be careful that it has to be tapered off and it has to be completely removed from the system. इसका मतलब है initially हम gums एक particular period के लिए देते हैं, 8 से 10 हफ्तों के लिए देते हैं, उसके बाद हम उसको taper down करके उसकी usage जो है वो बंद कर देते हैं. We close down, we taper it down and completely stop use of nicotine gums. Please do not refrain from using it as an alternative to your smoking or chewing habit. Remember that. Okay, and the healthcare provider will be doing that also, so please keep that in mind. Nicotine patches, अगर आपको मुंह बार-बार चबाने को दिक्कत हो रहा है और अगर आपको लग रहा है कि पूरे दिन में बहुत क्रेविंग हो रही है, ये एक बहुत ही अच्छा सिंपल तरीका है, एक पैच है. इसको आप अपने शरीर में अलग-अलग जगहों पे हिस्सों में लगा सकते हैं. बेसिकली नॉन हेयरी पार्ट्स में आप लगाइए. ये पैच कंटिन्यूअसली आपको डिलीवर करेगा निकोटीन जो आपको सिगरेट और तंबाकू के किसी भी रूप में मिल रहा है. इसका भी एक शेड्यूल है, इसका भी एक डोजेज है, एक टेपरिंग. Yes sir, over sir, almost over sir.
Yes fine.
So this is also something you have to keep in mind. Try to remember these instructions. Lozenges are there. Lozenges are, as of now, they have become the most common and quickly available products. अलग-अलग flavor में आते हैं. Please use them according to the instructions given by the dentist. And remember, कुछ side effects हो सकते हैं. हेल्थ केयर प्रोवाइडर को इन्फॉर्म करिए और उनको बताइए कि तकलीफें हो रही हैं. ब्यूप्रोपियोन है, ये एक ऐसी दवाई है जो खास करके जो पेशेंट्स हाईली एडिक्टिव होते हैं उनके लिए दी जाती है. दिस इज टोटली अंडर सुपरविजन ऑफ अ मेडिकल प्रोफेशनल. ओके, सो एंड आई एम नॉट गोइंग टू वर्मिक्लीन एंड ऑल दैट. One last thing which I want to say is, we have Professor Sonu Goyal here, Dr. Rakesh Gupta here. They will be telling you more about e-cigarettes and how e-cigarettes have currently been banned. So please try to understand that e-cigarettes are no alternatives to de-addiction or cessation. They are not an acceptable intervention at all. Today you are addicted to tobacco, tomorrow you will be addicted to e-cigarettes. E-cigarettes have been banned in our country and are no more available in the country. If they are available, it will be always nice for you to report that matter that these things are available and where they have been sold. So to conclude, pharmacotherapy is an adjunct to behavioral counseling and works very well when it is used in combination. It is the motivation of the user, end user जो है ना, वो अगर motivated है, this will work wonders. As Dr. Rakesh Gupta said, that the tobacco is a serial killer and we have to stop this serial killer. And these are the best ways. जैसे कानून के हाथ है, तो ये भी हमारे औजार है, यंत्र हैं, जिनसे हम इनको जो एडिक्शन को रोक सकते हैं और आगे और लोगों को हानि पहुंचाने से बचा सकते हैं. और जो लोग करंट यूजर्स हैं उनको भी इसके चुंगल से बचा सकते हैं. So thank you so much. They always say that difficult roads lead to beautiful destinations. De-addiction or cessation is a process. You have to go through that. It might take time from 1 month to 6 months, depending on how committed you are, how much support you get, not only from your family, not only from your physician, not only from your dentist and your friends. It is important that you take that path as early as possible if you are a user. Thank you so much for your patience, and I appreciate the opportunity given by Professors Goyal and Dr. Rakesh Gupta. Thank you, sir.
Thank you, Dr. Vikrant, for a very insightful lecture. I think it is equally matching Dr. Rakesh Gupta's lecture, where you have really simplified the counseling thing in a very easy way. So congratulations to you. I just want to add upon, I think, not actually adding, but the things which Dr. Vikrant has told. I always say about 4 Ds. Simple way of doing, if somebody want to leave tobacco, I always say 4 Ds. I am adding today 5th D. I was just seeing that from the session which has been taken by Dr. Vikrant and Dr. So 5th D actually struck me today. So what are these 4 Ds? So first D, whenever you want to leave tobacco, first is discuss. Always discuss it with your colleagues or somebody who is very close. It can be your family member, it can be your very good friend, because unless you discuss, he or she may not be able to help you when there is a craving or when there is some problems which are there. So always, whenever you are trying to leave, discuss with somebody. He or she will be the champion who will take you along to this cessation path. So first D is discuss. Second D is delay. So always delay your this whenever you are, like for example, you are smoking, anybody is smoking after every 4 hours. Do it 6 hours, do it 8 hours. So delay the thing. So whatever you can do, if you can delay up to a day, if you can have a day where you don't smoke sometime in between, so that will actually help you in quitting. The third D is divert. So divert your attention. So you can do like gardening, you can listen to music, you can read books. So whenever you have a craving, so if you divert your attention and you don't have cues in front of you, like you don't have ashtrays in front of you, you don't have cigarette packs in front of you, so that will help you in quitting. So third D is divert. Fourth D, which has been equally proven useful in many studies, is drinking water. So it's a very simple thing which people feel like drinking water or having a good nutritious diet, but it actually works. So if you drink a lot of water in between, so that reduces cravings. And the fifth D is deep breathing. Deep breathing. So yoga and deep breathing actually. So yoga and deep breathing is actually helps people. So there are not many studies, but few studies which have been quoted that when you all type of addictions actually reduces and you don't have much cravings if you do deep breathing exercises. So these 5D, starting from discuss, delay, divert, drinking water and a healthy diet, and deep breathing will prevent you from taking these drugs. So अगर आप ये drugs ultimately अगर ये काम नहीं करते हैं तो 6th D will be your drugs, which Dr. Vikrant has told, pharmacotherapy. This will come towards that stage. So I think these are some of the things which just need to summarize what Dr. Rakesh Gupta and Dr. Vikrant has said. So before I hand over to Dr. Rakesh Cipher, so I just want to announce 2 things to you, to the audience, that we will be having a national conference on tobacco or health, which will be there in September, 25th to 27th September. So you can all mark the dates. And we will be having a session for youth and children. A session, basically, we are trying to hold a full day for youth and children, in which a very simplified version of all the tobacco related sessions, not in a very scientific terms, will be there. So you can attend that session or you can attend the whole conference as well. So this is, you can see our website, NCTUH. If you type National Conference on Tobacco or Health, this is held after every 3 years. So this is the 5th national conference which is being held in PGI. So all of you can take part in it. Second thing I want to announce to you is we have a resource center for tobacco control, which is actually, as Dr. Preeti has said in the initial talk. So this resource center talks about some of the resources which are there, and you can find a wonderful resource like Dr. Rakesh Gupta is sitting here. So he has contributed some of the very easy to read some papers and easy to read things which you can go through at your ease. They're all in Hindi, so you can read them at your ease, and they are quite useful. So this is another thing which is there. So this is a resource center. I think somebody has put it down. So it has online course which is there on tobacco control. About national conference, it is there. All news and updates are there. What is happening in country, what is happening in globe. So this is about resource center, rctcpgi.org. Okay, so these are two announcements which I want to give, and now I hand over this to Dr. Rakesh Gupta, Cypher. Dr. Rakesh,
okay, Dr.
can you
Sonu?
please? Yes.
Yeah, thank you, Dr. Sonu. Yeah. So we have with us Dr. Monica Singh. So she's in private practice as a psychologist since 1995. So more than 42 years experience. And she was in Government Medical College, Jinta Hospital, Patiala as a faculty member. And then she was in multi-specialty hospital, General Hospital, Sector 16. And she has been awarded many awards in the area of psychiatry and psychology, and was also given National Award for the best paper on acute grief by Indian Psychiatry Society. So thank you, Dr. Monica, for accepting our invitation, and sorry for the delay also. So Dr. Monica.
Thanks a lot. First of all, thanks to all the organizers who have invited me on this forum. Dr. Preeti John, Dr. Cyril, Alexander, Dr. Rana, and you, Dr. Gupta, and a very wonderful talks by the speakers, Dr. Gupta, Dr. Sonu Goyal, and Dr. Vikrant Mohanty. So I would like to speak, actually it's such an important topic, and especially the counseling part is so important that it cannot do justice in just a few minutes, but I will try my best to make it little short and to the point. So first of all, we are talking about practical tips regarding counseling, and this was the topic given to me, but it is really, really vast. First of all, let's understand what counseling is. And are you able to see my slide?
Slide is not visible. Yeah, now it is visible. Yeah, thank you.
Okay. So now to bring it to your, this thing is that counseling is a very special form of interpersonal communication in which your feelings, thoughts, attitudes are expressed, explored, and clarified. It is a process of supporting a person, people to learn how to solve certain emotions, interpersonal and decision-making problems. And we help the people or the clients to help their own selves. Now, counseling can be done individually or as a couple, as a family, as a group. We go to the slums, we talk to villagers, we talk to some to give insight into the problem and also to give them information and clarity. So through discussions, clarification, and information, people are helped to become confident, to make their own decisions, take correct action. Because once you have all the information and knowledge about something, but if you do not put it into practice or bring it into action, it becomes quite irrelevant. So when you know something, you have to put it in practice to understand that we are also correcting it in the right way. And thereafter start taking charge of their life. Now, what is all this? Interpersonal communication is the mainstay of good counseling and is achieved by sharing. So what is the things to be shared? What are the person's difficulties he's facing while quitting? It gives immediate gratification, so he continues, and it boosts his pleasure due to dopamine rush, and it's a feel-good chemical in the brain, so he continues to take it. Now, in this come various things. How does he feel? And when we talk to a client or somebody who has taken this, or to the group, we say, how do you feel when you take it? And do you really wish to and how you wish to feel in life ahead. So once they have been given the information and clarity about the uh, the problems that they can face, the health problems or whatever problems that they can face due to smoking, we have to come down to these basic, very important areas. How you feel and how you wish to feel in the life ahead. Do you wish to be healthy, or so and so forth? And what are your emotions like? Are there change in emotions? Does it really give you happiness, thrill, relief due to dopamine? And then what is your role of self-development? What is the personal potential you have? Stimulate dopamine and able to outgrow our addictions. What is your belief system? Do you believe that you can quit? Visualizations, that means we also visualize and see how we can lead to a better desire to quit and take it as a challenge. Do you have that kind of belief? And so, what are the values that were given to you in childhood, and are you abiding yourself? It is also important, once you bring in the rapport with the person, which is the most important part of counseling, and then being a good listener, that you are able to talk to him about what is uh, who was the ideal self that you thought you would be when you grow up, and where are you? What is the real self that you are evolved? What can you do to bring about a change? And what are your attitudes? Whether they are the attitudes are harmful versus not harmful. How would you respond if a dear family member or a friend was in your place? So these shows all the attitudes that a person gets. Now, how are goals achieved? The behavior change that we were talking about through the communication. First of all, the person is unaware. And so how to give him awareness? We give him information, we give him a lot of understanding about the harms of nicotine and other substances. We give them awareness, and then we show concern. The concern that it is important, and we are also concerned for your health. After giving them all this, the person is considerably knowledgeable about the issues. And then we bring him that what motivates him to change. Um, is it because of what is it? What is the thing that will happen if you quit it? What is your need and desire and urge to bring about this change? So the person voices it. It's because I keep talking about, I know it shouldn't be done, but I don't want my grandchild to continue with it. I don't. So is it because of your family members, your friends, or your social image? What is it that you want to bring about a change? And then, are you ready for that change? So you have to motivate him. So counseling is also about a lot of motivation, which is, it's not just the first interview. It is also continuity of it. You have to make the person feel that I'm interested in your. So follow-ups are extremely important in this area. And then we see the trial or assessment of a new behavior. Once it starts or launches off, then you have to give, timely rewards by praising or whatever, that I can notice that you are trying to make the new behavior, and it is observable. And the last part is that we have to make the behavioral change that he brings about, whether it is sustained or it is lost somewhere. So in order to have that, we have to keep the sustained behavior change by keeping in touch, and even if he has relapses, how to bring about, uh, uh, take a reverse gear in that and bring him back to where he left. So briefly, just going into this, rapport building is important, getting the person to talk, and in a good interview, when to move on, and then how to end the interview. I've already talked to you that it is done to a couple or a large group or a small group. And effective interpersonal communications also involve verbal and non-verbal communications. And it's important that the counselor who's doing it is able to give the feeling to the person that he is well attended, heard, and understood. Now, here are some of the consequences of tobacco use. Any unhealthy behavior must be unlearned. And the good thing about this is something which is learned can be unlearned. Okay, so this is the one big message that you have to convey to others. If you are going to be motivators in the coming time, you are wanting to quit or you're going to help people quit, understand this. So identify the behavior as harmful, understand what are the alternatives available to replace that faulty behavior with a good alternative. Be able to act on that knowledge and receive support necessary to maintain the behavior change. Counseling programs provide information resources to help tobacco users, then to develop a quit plan, address specific barriers to quitting and seeking support for their efforts, and manage withdrawal symptoms and stress to prevent relapse. Counseling has also shown to achieve success along with cessation medication. In fact, it is always better that medication, along with that, the treatment plan is counseling. So it's a very important plan. So it's not just the medication, along with that, counseling and repeated counseling is very, very important. Effective counseling is tailored to meet individual needs and preferences. So there can be many, many reasons for the person to this thing. I will skip this because you all know what are the various medical treatments available. And now we're talking about the individual. Provide a series of in-person individual counseling with a trained tobacco cessation counselor, and address the unique individual issues. He may have very different. Don't just presume and assume that the person, everything is the same for all. No, they are very individualized, and that is why a one-to-one individual counseling is always better. Then offer the reinforcement and continuing support. In the group counseling also, we try to give information, we interact and help people to have give them positive reinforcement. Now there's a process of cessation, the 5 A's. Ask information regarding this and the person's tobacco use. Advise. The advice has to be strongly urged. Urge the tobacco users to quit tobacco. Give a very clear, strong, personalized message. That's very important. Yet being supportive and non-confrontational. Assess the situation, whether the readiness to bring behavior change and willing to quit, say give him a target, say within the next 30 days, are you able to do it? Okay, sometimes also you can tell them, okay, are you willing to take a challenge? Assess his or her nicotine dependence and reevaluate it periodically. The next is assist regarding the quit plan, who are willing, not willing to quit, and of course, explain to them if you are willing to quit, how you need to continue with this feeling and not give it up in between. And if you're not willing to quit, explain to them the benefits of quitting. Arrange for discuss problems while quitting, importance to follow up and to avoid relapses. I'm just hurrying up because I want to, you have to re-educate counseling. You have discuss the benefits of tobacco cessation, better health, reduces risk of heart disease, lung disease, infertility in women, show films, charts, talk shows, road shows, and also another benefit is, it gives the person a very high self-image and his self-esteem goes up. He saves money, he gets the love of family and improvement his appearance, his teeth, or even his overall appearance improves due to better health. Now, use of cognitive strategies. Motivation to quit and encourage to turn over a new leaf. Who motivates him to quit? I've already talked of this, whether it is his family members or friends. What motivates him to quit? For health benefits, religious purposes, financial saving, better social image. When can he quit? So let him choose. Help him choose a quit date. Discuss triggers, whether an incident leads to it, whether it is learned behavior, whether it is due to peer pressure, whether it is change in social living and other patterns in his life. Somebody has already talked about the 4Ds. And yes, I'll just reinforce it again by saying delay the act, slide it away, do deep breathing, learn muscular relaxation exercises. The Jacobson's progressive muscular relaxation is usually taught. Drink a lot of water, hold water in mouth, and distract yourself. Indulge yourself in some other activities. Telephone counseling is also available. Now, coming to this training in problem solving, cognitive behavior therapy. This is the most important. Here, we deal with the various thoughts that come into the mind when the person gets the urge to do it. It leads to, so when you have a thought, it leads to a certain emotional reaction. It may lead to distress when his body wants the activity that goes into the emotional part is he may feel very sad, anxious, angry. He may want to fearful of certain situations, and he wants to rectify that feeling what he's getting by not having the nicotine in his intake. So once he gets a thought, it leads to distress. I've told you all the distress areas: sadness, anger, whatever. And in order to take care of those issues, he may get a compulsion to carry out the act by smoking. And then he may get a relief because he's getting the relief in the, dopamine levels go up and he gets better. So this is the cycle that the person revolves.
So, Dr. Monica, we need to conclude actually. So,
all right.
We can sum up.
Okay, so I'm just telling you cognitive.
Yeah, I know you're very passionate about the topic, but we can take questions from audience, right? Thank you.
Okay.
So if you have concluded, then can we take the question and answer questions from the audience?
Since you asked me, you can,
or you can just say a few concluding words if you want. No? Just your practical tips. Dr. Monica, you can say something here.
Yeah, just a moment. So these are the core skills. That is ORS, acronym banaya hai, open questions. You ask them how much you take, all the affirmations, reflections, and summaries. I've already talked to you about the behavioral stages. And the client, why do you want to make a change? What are the reasons? What are the benefits? And these are very important. So I want, the reasons are this, I can, I wish to, I will, and it would solve problems. Then we start making a planner, and the planner has to be smart, which means it has to be specific, measurable, achievable, relevant, and timed. The vulnerability of the person has to be taken into view, whether it is more vulnerable or he's not. And is he able to assert? Is he able to refuse? Yes, how to say no is very, very important. And not to succumb to peer pressure, how to deal with it, how to assert yourself. Okay. Ongoing support. Like, I'll tell you something. There are people who come and tell me, but he gave me the cigarette in my hand and he said, ले isko. So एक चीज है, कोई भी व्यक्ति अगर आपको कोई ड्रिंक भी देखता है, पकड़ाता है, try to learn how to deal with that solution, how to bring about effective solutions. So what is the incident? What I did? What was my reaction? What I did? And actually what I could have done. The last one is the most important, which is the finding effective solutions to the problem and acting on them. So the rest, I think I've already, and thank you very much. I've tried to this thing, but there are also other things like, what are various verbal communications. I'm not going to go into those details. And so we'll continue with the with your talk, whatever you want to. Thank you so much, all of you.
Thank you, Dr. Monica, for letting us know about the importance of counseling in quitting tobacco. So thanks a lot. So we have with us Dr. Sandeep Singh Gill. He is State Nodal Officer for National Tobacco Control Program in Punjab. So Dr. Sandeep, can you say a few words about this issue?
Yeah, greetings from NPCDCS Punjab. First of all, congratulations to all the teams have been participating, and students, especially this program. Like the focus group is the students, who are the most vulnerable, where we are targeting the starting of tobacco addiction. So our all emphasis should be on this age group. I'm so impressed with all the speakers who have given a beautiful talk, and they have apprised us of all the latest good information. As such, tobacco industry, which is a big problem for us, which is not letting us. A few days back, only I got a complaint from District Mohali. We have a NGO called Generation Savior, who have been doing good work, in controlling the tobacco vendors, manic, So a lot of the retail associations, they have been, threatening these people. The industry is a big challenge how to tackle with this. Of course, understanding the various issues in depth. You are the expert, and a lot of Dr. Rana has been an expert. We'll need a lot of information and help from such seminars. Thank you, all of you. It was good to be here on your platform, and especially Dr. Sonu Goel has been doing good, and we have been in association with him. Thank you, everyone. Thank you, Dr.
Thank you, Dr. Sandeep.
Yeah.
So I'll just like to tell a few words about that electronic cigarette. The electronic cigarettes, because many youngsters, they may be using electronic cigarettes, though it is banned now since December 2019. It is permanently banned in India, but still it is being made available through e-commerce sites, or even through WhatsApp messages or whatnot, through the social media sites. So I request all kids. It is pure nicotine. It is nicotine in chemical form, and it is a poison. It is an addicting product, and it can cause any kind of disease, all kinds of disease which that tobacco cigarettes they cause. So please don't start with this habit of using electronic cigarettes, or it is popularly called as vaping. So with this, I think since we are already getting late, so we need to skip this question and answer session. But I have put my email ID in the chat box. It is cipher, SIPHER 2018 @gmail.com. So you can send all your queries, any kind of queries, you can send it to me, and I can answer these if I can answer myself, or I can forward it to the panelists so that you can get answers to your queries. And I request all to just switch on their videos so that we can take a snapshot. So all are requested to please switch on their videos. Yeah. So Sanaji, you can just remove the, yeah, thank you. So Sanaji, you can take a snapshot, or Mr. Mindra can take, yeah.
Yes, sir.
So take all in the frame one by one, right?
Yes, sir.
So please let us know when done.
Yes, sir, it is done.
So thanks a lot. And now I'll request Mr. Arun Verma, he is Director Finance and Operations with the Cipher, to just propose a vote of thanks. And thank you, Ria, for all the efforts.
Yeah. Thank you, Dr. Rakesh. A very good afternoon to one and all. I have been entrusted this pleasant duty to propose a vote of thanks to all the participants on behalf of organizers Chitkara Global Health Institute, CGHI, Chitkara University, Strategic Institute for Public Health Education and Research, Chandigarh, and E-Resource Center for Tobacco Control under the Department of Community Medicine and School of Public Health, PGMIR. First of all, I wish to express my sincere gratitude to all our highly eminent panelists, Dr. Rakesh Gupta, who is a president, Rajasthan Cancer Foundation, Jaipur, and an honorary consultant, Tobacco Control Association, Dr. Vikrant Mohante, associate professor and head of the department, Maulana Azad Institute of Dental Sciences, and Dr. Monica Singh, a consultant, clinical psychologist, for taking the time out of their busy professional commitments to be part of this workshop, deliberating on the various ways, options, solutions, and opportunities to quit the use of tobacco and nicotine. I must appreciate and I must congratulate Dr. Rakesh Gupta ji for a very highly innovative and impressive way of making the presentation where empowering the participants. Thank you, sir, very much for this way of presentation. It has really, put us in a very comfortable position to understand how one can quit the tobacco. Dr. Vikrant Mohante, I mean, he has, given a very impressive talk on what pharmacology is for the cessation. And sir, you have nicely said that pharmacology therapy is an adjunct to the behavioral consultants in counseling, as the combination significantly enhances the treatment outcomes, and motivation to quit smoking is a critical for good success. Dr. Monica Mehra Singh, she has given a detailed talk about the importance and effectiveness of the counseling and a detailed interaction, with the concerned person to how to quit tobacco and the importance of counseling over the medication. Thank you, madam, so much for your very impressive talk. I also wish to express my sincere gratitude to Mr. Cyril Alexander, ED, Mary Ains Charity Trust, for a highly knowledgeable and impressive talk exposing to the audience to the idea of involving children and youth in the tobacco control and TM applications. And Dr. Rana Jay Singh, Regional Director at International Union Against Tuberculosis and Lung Diseases, for giving an overview on the background of the topic of Tuesday's workshop. Dr. Rana Jay Singh has very correctly said that we keep on saying all these things on various platforms and forums, but today's workshop is very important from the point of view that a lot of youths are now audience in this. I also express my hearty thanks to Preeti John, Director, Chitkara Global Health Institute, Chitkara University, for extending warm welcome to all the speakers, panelists, and all other participants. I also wish to convey my big thanks to Dr. Rakesh Gupta, Director President Cipher, and Dr. Sonu Goel, Director, E-Resource Center for Tobacco Control, PGMR, and Professor, Department of Common Medicine, School of Public Health, for very nicely conducting the technical session and moderating the panel discussion. I also thank for their initiative to motivate the Chitkara University to hold this workshop in collaboration with, CIFER and PGI. Further, I must also express my sincere thanks to the entire audience who have shown keen interest in this subject by joining the workshop either through the Zoom link or on the YouTube. I thank Ms. Riya Jan for very nicely hosting this session throughout. I thank Dr. Sandeep Singh for joining briefly, who is a nodal officer for the state of Punjab. And in the last but not the least, I thank all the staff of the Chitkara University, as well as CIFER and PGMR for their efforts to organize this seamless session. Thank you one and all once again. Jai Hind.
And thank you,
Thank you
Vermaji.
so
And
much,
I'll also
sir.
like to thank Madam Sohana. Sohana, she's in Department of Physiotherapy for coordinating it very efficiently. And thank you to Madam Preeti Jain and Riya Jain. Madam Preeti John
Thank you
and
so
Riya
much,
Jain.
sir.
Thank you. Thank you.
Yes, thank you so much, sir, for your kind words. We're very grateful. This hereby marks the end of the session. I thank everyone for taking out your precious time and attending the session. The participation certificates will be emailed to you on your registered mail. Thank you all. Hope you have a great day ahead. And if you have
Thank
any
you,
query,
Riya. Thank
kindly
you, Riya.
please email it.
Thank you. Yeah, and we have with us Dr. Mahendra. He has also done a lot of hard work